IDRC and Global South community. I'm absolutely pleased to be communicating to you today about the good work that we're doing. I am Dr. Daudi Jjingo. I am faculty in the College of Computing here at Makerere University, but then I also help lead this African Center of Excellence in bioinformatics. And for the IDRC work, what we're really doing is I'm leading the group that is developing a chatbot for COVID-19 and other pandemic interventions. It's very interesting what happened in the COVID-19 pandemic. As most of you might know, really one of the biggest issues, there was the medical issue, which is how do you treat this thing? But then the other thing was actually information management. As you might all have noticed, there was a whole lot of misinformation about COVID-19. And that meant that a lot of health workers were spending huge amounts of valuable time actually just trying to talk to patients and explaining concepts and explaining medicines. And so what we are actually doing is to develop a chatbot, which is a kind of computation AI-assisted solution that would help automate conversations so that patients and the general public can call in and have a conversation even when health workers are busy doing something else, or if it's late hours of the night when nobody can be picking up a phone. It is a solution that is also scalable because many more people can call in and get answers rather than speaking to one health worker one-on-one. So that is what this automated chatbot is trying to do. This has been a very interesting engagement and an interesting challenge. So we started off by, first of all, identifying talent and skill within our ecosystem here, our community, identifying the kind of individuals that we need. And so we put together a multidisciplinary team, really. First of all, with data scientists who we're using to develop the AI algorithms and machine learning algorithms that are required to put these kind of automated conversations together. It's a team that's also made of software engineers. We do have software developers on our team who are developing both the back and front end of this solution. We also have IT specialists because it's a data-intensive solution. It involves a lot of sophisticated hardware, high-performance computing environments, server management, and so we've had to do a whole lot of work around hardware management. And so we have IT specialists on our team. We also, of course, have communication specialists. We've been working with doctors who engage with patients to help inform this solution. We've been working with a coordinator, somebody to help coordinate the team. And of course, we've also been working with language specialists. A chatbot is a conversation. And so you need to be able to understand language intrinsically, extrinsically, the patterns and syntax of language. And so we've been having language specialists in our team. So this is a very multidisciplinary solution. We've been doing a multidisciplinary team, and over the last 1 year, we've had to put all that together and then start work. A lot of that involved collecting data, a lot of data from our medical colleagues here at the Infectious Diseases Institute. It involved a lot of hardware configuration. It involved a lot of software development, and of course, it involved a lot of language processing. And towards the end of 1 year, really, what we have is you could say a fairly functional chatbot at the text level, where somebody can input text questions and get text answers. So we are at that level, and we've been able to do that for both Luganda and English. Luganda is an undersourced language, so the task has been a bit harder to get it to function at this level. But we have that now, and now we're looking to fine-tune that in the second year. This is not a mundane task. First, language technology, natural language processing is still a work in progress as a field. So that has been a challenge. We've had to do a lot of innovations around how to process this text and how to extract patterns. So there's been a learning curve on that front. like I said at the beginning, getting the skills that are required also took some very elaborate work trying to get these people together. That was a challenge at the beginning, but came together pretty well. As you might expect with all AI data science projects, we had a big challenge around data, collecting this data from the general public, from medical professionals, from clinicians, and collecting this data, and then curating that data. That was no mean feat as well, but it all eventually came together. And of course, as one might guess, resources have been a challenge. We had to work very hard to fit within the budget that we have, and have a lot of improvisations around that. So resources have been a challenge, but we have managed nevertheless. This project, despite a lot of the challenges that I just articulated, actually has also provided great opportunities for our ecosystem and for our membership here. One, we've had the opportunity to actually develop the first automated chatbot in our ecosystem around health at all. So we feel that it provides a great opportunity to both expand and scale such a solution into other pandemics, into other health situations. That has been such a great opportunity that this project has given us to begin defining automated conversations as health interventions and getting together tools for that. It has been also an opportunity to learn. We've learned a whole lot about how to configure hardware, how to program, how to do software development, how to do team mobilization, and again, how to do this even remotely and online, because obviously we did this during COVID-19. So that was a great opportunity. It has also given us the opportunity to put together an excellent data set that can be used to understand how communication happens between clinicians and patients, clinicians and the general public, how the general public approaches inquiries around their health. So we have a good data set, which was a great opportunity out of this. Even more, we've had the opportunity to actually train a PhD student. This project had a PhD student who is doing some work again around language, around local language, what we call Ugandan English. So it's been an opportunity to further education and further skills in the environment. This is going to have a lot of good outcomes. The first and obvious ones is, of course, the chatbot. Generally, being able to have automated conversations, that's one. But two, we're doing this in English, not just English, but Ugandan English. So there's a lot of nuance that comes with that. And so we are very excited to have that come out. And then secondly, we're also doing it in Luganda, which is a local language here in Uganda. And this is very, very important. Our clinicians tell us that almost 90% of the communication they get from the general public happens in a local language. And so it's important for us to have resources appropriate solutions for this. So Luganda Chatbot is going to be an excellent outcome of this. Like I mentioned, we're going to have a PhD student come out of this. Actually, there's a second one who decided they should take on a PhD after doing some of the work we've been doing here. So we'll have ultimately, outside of the lifetime of this project, 2 PhDs coming out of this with excellent deep expertise around this. We also, of course, hope to maintain the team that we've developed around here. It's also a product in and of itself because we'll be able to produce, to work on other solutions eventually, resources allowing. There's a lot of ideas that have been generated along the way, and we hope to pursue them as and when opportunity and time allows. And with such a good project that has been able to happen, we really appreciate the support that came from our funders, IDRC, the Global South, CEDA. It's been excellent help, and we really want to appreciate that. We definitely look forward to working more with you. There's a whole lot of solution space that has been conceived as a part of doing this work, and we hope to continue working with you in bringing some of those solutions to bear. So we definitely want to appreciate our funders and also to express our definite willingness to continue working together.